At this time, I'd like to go into our final session, which is run by the real scientists, not the physician scientists, but the real PhD scientists. The first one is Dr. Whitney Wharton. She's, they call her a junior investigator, but she's extremely knowledgeable and extremely well experienced in issues of hypertension and how hypertension affects cognition. She's a cognitive neuroscientist specializing in Alzheimer's disease and related disorders, particularly as it relates to hypertension. She's currently conducting an NIH-funded study investigating the influence of peripheral arterial function on Alzheimer's biomarkers and by measuring beta amyloid levels and blood-brain flow. Our second presenter is Dr. Chantal Kersens, who is a psychologist originally trained in Amsterdam, who in previous years here at our forum has brought in technology using the computer to help persons with dementing behaviors. Dr. Kersens started a healthcare startup that was run out of Georgia Tech, the Georgia Tech incubator, to help develop and vet cutting-edge technology for seniors with dementia managing at home. And she was a principal investigator of a $1.2 million NIH grant for similar studies. She's recently started her own business, helping companies and universities develop and test digital health applications to meet patient and caregiver needs. So at this time, I'm going to let you hear from Dr. Whitney Wharton, followed by Dr. Kersens, and then our summary question and answer period will follow after that.
Hi there. Thank you so much for having me, Dr. Parker, and for putting all of this on. I know a lot of work went into that, so thank you also to Natalie and Cornelia. Also all of our other speakers. It's just been great meeting you. Today's been really informative for me, just a lot of great information. I love that it's relevant to women, and thank you all for sticking around after lunch to have what I hope is going to be a good last couple of talks. Top one, thank you. So as Monica mentioned, my name is Whitney Wharton. I'm a cognitive neuroscientist. I'm with the Emory Alzheimer's Disease Research Center. I've been there for about 3 years. I am older than I look, actually. I got my PhD about a decade ago and did a faculty stint at the University of Wisconsin in Madison. And I actually came here because my research focuses on vascular risk factors and how those affect Alzheimer's disease. So I study diabetes, blood pressure, things like that. And I came here because I want to study and enroll individuals who are most at risk for Alzheimer's disease. And as you've heard today, that means women, and also that means African Americans. So I don't know if any of you have ever been to Wisconsin, but the number of African American participants that we were able to enroll is not as much as we would have hoped. So that's what brought me here. So thank you, and I see a lot of my research participants in the audience. Yes, I'll talk about it. So thank you so much for being here, and I should also say I have no disclosures, and I receive funding from the National Institutes of Health, the Alzheimer's Association, the Foundation for Health Improvement and Technology, and from Department of Neurology at Emory. So I'm going to start off with some Alzheimer's disease facts, and then I changed my slides a little bit after hearing after seeing some of the slides, so that I try not to replicate myself and replicate prior speakers, and you get as much information as possible. So I'm going to touch on hormones. I'm going to focus on caregivers. So that's the individuals who I enroll in my studies. I look at people who have a biological parent with Alzheimer's disease. I'm going to focus on depression and mood and some of the affective issues surrounding caregiving and predisposition to Alzheimer's disease. And then I'm going to talk about things that you can do to improve your brain health and improve your cardiovascular system in general. And then close with some research opportunities that some of you might be interested in taking part in. So I like to start off with this slide. This is the all-cause mortality rate for major causes of death from 2000 to 2010. You can see here on the x-axis, it lists major causes of death. This is, again, over a 10-year period. And you have breast cancer, prostate cancer, heart disease, stroke, HIV, and on the far right, you have Alzheimer's disease. And if you notice, all of these causes of death, because of science and advances in technology and medicine, have gone down. So we seem to have these, pretty well under control. But here on the right, on the right bar, in the right column, you see Alzheimer's disease is actually up 68% over that 10-year period. So it was mentioned previously, Alzheimer's disease is the second biggest, age is the first risk factor for Alzheimer's, and the second is gender. And clearly that means that women are disproportionately affected by Alzheimer's disease. And to put that into perspective, what that means is women in their 60s are twice as likely to become afflicted with Alzheimer's as to develop breast cancer. There's a number of reasons for this, and this deals with genetics, physiological changes in our bodies, primarily estrogen, which you've heard a lot about today, the psychological effects, the psychological contribution to Alzheimer's disease, and also environmental and situational factors, and I'll touch on all of these briefly. So we've heard a lot about menopause today. And it's not really menopause that we focus on. We talk about that a lot. But as a woman, the estrogen, the endogenous estrogen in your body is so important both for vascular and for brain health that large changes in levels of estrogen, the type of circulating estrogen, has a lot of effects both cognitively and physiologically. When we go through menopause, the average age is about 52 to 55. If you're going through natural menopause, there's a few differences depending on race and things like that. But before menopause, the main type of estrogen in your body is called estradiol. And then after menopause, the main circulating estrogen in your body is estrone. So not only do the levels change, but the type of circulating hormones in your body change. And it's the body's natural response that when the estrogen that is endogenous premenopausally, the estradiol, has a precipitous drop, then this causes all sorts of physiological things to happen, and we know that these changes also affect your brain and your cognitive health. Specifically, when estrogen levels drop, your heart and blood vessels become less elastic and less able to dilate when your blood starts pumping. And what this causes is hypertension, high blood pressure, high cholesterol, diabetes, and also the change in estrogen causes us to gain weight. So while it's shown that there are behavioral and environmental reasons that women tend to gain weight during the menopausal transition, this is also actually due to the hormonal changes that are going on naturally. So the adiposity that we tend to put on during the menopausal transition, as long as it's within safe levels, that is just a natural body composition change that happens during menopause, and that estrogen that comes from that tissue is actually protective, and it's protecting our lady parts. So the worst thing that you can do is go get liposuction and try to get all of that out, because it is, again, there for a reason. Our body just changes.
Yay. It's good to know you.
It's okay to have a rubber tire.
I'll skip this one. We talked about that. So I'm going to switch a little bit and switch away from estrogen and talk about women and caregiving. as I mentioned, I enroll individuals who have a biological parent with Alzheimer's, and I see many of you in here. And I talk to each of my research participants when they come in and try to answer their questions. And something that is consistent is that people in my studies who are caregivers, everyone comes in with a story and a very unique experience, and they are all concerned, both for their parent that they are most likely caring for or have at one time cared for that has Alzheimer's. They're nervous for themselves, and almost always they have children who they are physically still supporting, and if not, they're almost always still financially supporting their child. So women in general, which is very true and it's been said today, but it can't be said enough, women tend to take on the role of a caregiver for the entirety of our lives. And there are physiological issues that go along with being a caregiver. Not that it's not wonderful, and there's positive aspects of being a caregiver, which we'll absolutely talk about, but always putting someone else first can sometimes, if you don't take time for yourself and take care of your own body, can have ramifications. And the ramifications on your body also translates to ramifications on your brain. So that's what we're really trying to get at. So research shows us that 1/3 of women Alzheimer's disease caregivers are 24-hour caregivers. This is a lot of caregiving hours, and this is a lot of time that a lot of people don't have reprieve. 40%, the same study showed that 40% of these caregivers said that they did not feel like they had a choice to become a caregiver. So they just fell into that role, and there's differences depending on race and age as far as these things go as well. But it's most often a spouse who just says, this is my role now, this is what I'm going to do, or an adult child saying, I am able to fly, I'm able to take off work, so I'm going to take on this role. The same study showed that 2/3 of all Alzheimer's disease caregivers reported to having to take off work, to go into work late, to rearrange their schedule. And as we heard earlier, this means taking women out of the workforce, because again, there's an overrepresentation of female caregivers. So if you're not at work, you're not getting paid, and you're not able to pay for home health or just things that we need to be able to take care of ourselves. So there are some psychological and situational issues that go along with being an adult child caregiver that I want to focus on. So these people have a biological parent with Alzheimer's. They're middle-aged, from about 45 to 65, we'll call that middle-aged. And there are some things that go along with being an adult child caregiver that seem to be consistent across almost everyone. Oftentimes, adult child caregivers will have poor nutrition. They will have lack of exercise because you don't have time. They will have sleep disturbances, very high levels of stress, which I'll focus on in a second, financial complications, which go along with being a caregiver, and also their own healthcare neglect, because they're taking care of so many other people. They don't take the time to focus on themselves. And as we heard earlier today, each one of these individual factors is a risk factor in and of itself for Alzheimer's disease. So by a caregiver not taking care of themselves in this way, they are putting themselves at increased risk for Alzheimer's, and then the pattern just repeats itself. I also want to mention that in addition to some of these things, there's the psychological aspect to go with this. What I hear a lot after I really delve into conversations with my own research participants is people feel lonely. They feel very isolated being a caregiver, because we grow up taking care of our children, and I have a 12 and a 13-year-old, and I have resources out the wazoo for these kids. I have help from teachers, from church, from other family members, all of these things, and everyone knows about all of these resources. But if you have a parent with Alzheimer's disease, people sometimes don't really know what's available, what you're supposed to be doing. For sure, in some populations especially, there's a stigma attached to Alzheimer's, so we don't really want to talk about it because we don't want to be portrayed as being disrespectful. So we don't seek out these sorts of resources like we do with our children. So I think that's something, just relieving the stigma associated with Alzheimer's is something that needs more work for sure. So on average, caregivers report much more depression and stress than the average middle-aged person. One study showed that 60% of Alzheimer's disease caregivers rated the stress of caregiving as high or very high. And again, both of these things are independent risk factors, stress and anxiety, for later Alzheimer's disease. And there's different reports of Alzheimer's disease, middle-aged adult child stress, depending on a couple of things: the mobility and the level of wellness of the care recipient, the gender, and the age of everybody involved. To touch on the racial differences in caregiving, unlike Caucasians, if you look at Caucasian family caregivers of Alzheimer's patients, it tends to be, if you're looking at Caucasians, it's the spouse of the person that has been afflicted. Also, caregivers, because it's the spouse, tends to be older, so not the kind of middle-aged person that we see in the African-American community. Among African-Americans, family caregivers tend to be women, tend to be middle-aged, and tend to be, again, the adult child of their parent with Alzheimer's. African Americans are also more likely to try to keep their parent in the home and not put them in an assisted living facility, and if they end up going into a nursing home or a facility, they stay at home much longer before that decision is finally made. And I just say that to stress that having someone in your home, and again, the idea of the 24-hour caregiver takes a toll. The idea of a 24-hour caregiver takes a toll on you physiologically and psychologically. And so these people are most at risk, and people that we need to make sure that we have appropriate education and intervention options for. We've talked about this a lot today, but for the adult child caregiver, there's also biological issues that happen. A lot of these are the direct result of the behavioral issues that go along with being a caregiver. Many adult child caregivers will have high blood pressure, they will have high cholesterol, dyslipidemia, and of course we have all of the changes that go along with the menopausal transition that we've talked about. Also, it's important to emphasize that if you are an adult child caregiver, middle age is not only the time where there's physiological changes in women because of menopause, but also this is the time of life when we know these plaques and tangles that cause Alzheimer's begin to accumulate. So middle age is really when we're trying to focus on prevention and a meaningful intervention, whether or not that's a pharmaceutical answer or a lifestyle intervention, something to really prevent these plaques and tangles from accumulating. So I think we're running over, so I'm going to pass this. So I wanted to focus really quick on some actually really interesting research that I heard recently that came out of Rush. And that focused on attitude and the brain. So this isn't necessarily depression, because it's important for us to remember that wellness is not just the absence of disease, but it's also doing things to promote physiological and brain health. So even though women are more at risk, there's a lot of things that we can do to not necessarily negate the risk, but to counteract it. And this really kind of struck a chord with me and seemed really interesting. So attitude, meaning things such as subjective well-being. We have found genetic links to these types of things, but more interesting is that if there's been a lot of research that shows if someone has the impression that their life has a purpose and that they are a part of a community, that they are not isolated and that they are being heard, these things have been related to the proteins, the beta amyloid that causes Alzheimer's disease. The study that came out of Rush showed that having a positive outlook on life was related to less strokes, both clinical strokes and the silent strokes that you hear so much about. So, and importantly, even though some of this is genetic, these are things that you can kind of reprogram in your body to try to be a positive person. On the flip side of that, there's also been research showing that negative social interactions can actually be related to brain health specific to Alzheimer's disease. So one study that came out was, a questionnaire was, in the past month, how often did people that you know do a number of things like leave you alone, give you unwanted advice, fail to provide help to you, or be unsympathetic or insensitive to your situation. And what they found was that individuals, over a period of 4.8 years, the more negative social interactions that these people had, those people were that instance was associated with mild cognitive impairment, and then among the people that already had impairment, with a faster kind of decline. So, you know, this again is something that we haven't heard about today, but something that you can kind of try to change in your own personal life. So be around positive people, stay away from negative situations as much as possible. Something else I wanted to mention is making sure that you educate yourself. We've had a lot of information today, and I know that there's a lot of information in the news. One of the best things that you can do is be proactive and do your own research. And there are venues online where you can do this. I would suggest PubMed and Google Scholar. That way you can go, if you see something in the news that says, you know, aluminum is bad for Alzheimer's disease, aspirin is you know, all these things about luminosity, you can actually go and read, it's called the abstract, a summary of some of these research results, and make your own conclusions, or take them to your doctor and try to ask your doctor if you should be on a certain medication or if a certain lifestyle intervention will be good for you. So we've talked about a lot of this. I think I'll just close by saying, I know I'm over, I'm sorry, saying when we're talking about interventions, to whether it's hormone therapy or exercise, things like this, really be proactive and weigh your pros and cons. As far as hormone therapy, you know, if you don't have a family history of vascular disease, if you're currently going through the menopausal transition, there was a recent study that came out that showed that if given during the menopausal transition, neither the pill or the estrogen patch had a negative impact on your vascular system or on your brain. So if your menopausal symptoms are such that they are overwhelming and it's difficult for you to function, that's something that I would discuss with your doctor. And more than anything, just really, if you're a caregiver, taking time for yourself to kind of center. And for you, whether that's having, you know, a conversation with a loved one, whether it's going to church, going to yoga, make sure you take that time for yourself and you're really exercising self-care, because that will benefit yourself, your children, and you'll be able, in turn, to be a better caregiver for your parent with Alzheimer's. Thank you.